In the dark, it looks so till I get to one that stays open night and day. Just a looking at the sleeping sea. In the night, it looks so no one sees the sun. All right. Welcome to the show. We'll give Dr. Riggs a couple minutes to kind of join us. Otherwise, we will just get started straight up. It's a pleasure to have you all here. My name is Dr. Derry. Joining me usually is Dr. Riggs, who is a few minutes behind schedule here. We have a daily podcast called NoiseFilter. You can find more information about NoiseFilter on all the podcast subscription platforms that most people usually listen to podcasts on. Please write us a review on the Spotify or the Apple network because that'll help more people find this podcast. And what else? You can find more information about us on noisefiltershow.com. So with that being said, let's just go ahead and get started with the numbers. We do have a guest on today, and that'll be very interesting. This is somebody who wants to share their story with us. She does have COVID. She has a history of having had COVID-19 and is very interested in sharing her story with us, and we're certainly very interested in hearing about it. I also want to say thank you to all of the folks that are able to make this show happen. That's the entire AIDS Education Training Center team, as well as Access South Louisiana. And today, particularly thank you to Christopher Atkins. Thank you very much to Sydney Soublé. So with that being said, go ahead and let's get started with our numbers. And where are we? We are right here. If any of our AETC folks are listening right now, maybe maybe you can help wrangle Doc Griggs into the show. With that being said, let's go ahead and get started. As you can see here, we are, slowly creeping up to the 5 million mark. We are at 4.6 million cases. You can see we added about 83 million cases overnight. We are, at a rate now of about, if you think about it, takes 10 days at 100,000 cases to get us to a million cases. To get us to a million cases, you can see we're about every 13 to 14 days. I do want to remind you that it took something like 3 months to get to a million cases. It took about a month to get to 2 million cases, and now we're about every 2 to 3-ish weeks, and we're adding a million cases at a clip there. So, of course, that's not where we want to be. Welcome, Dr. Griggs. You're on mute. We also added about 4,000 deaths over. Very fancy, Dr. Griggs. We added about, go ahead. Let's see how fast that thing starts steaming up. Oh, look at you, fancy. Is this how you're going to go out to eat this weekend, like that?
Yeah, I'm going to walk right to my refrigerator and eat my frozen meals just like this.
We added about 4,000 deaths, which is pretty normal for us on a global level. We're still about 3 million people die per minute. And as we say every podcast or every time we do this live broadcast, at the end of this broadcast, we are going to have had about 180 people die just as we talk here. You can see, again, we had a little bit of an uptick of cases right here, which we will see reflected tomorrow in the worldometer. But you can see here, again, we are maybe slight plateau, and maybe with a slight increase in cases going up again. We anticipate these cases to be going up again as we start to see more cases come online and testing to be happening more in resource-poor countries. This definitively looks like a downward trend in mortality, which is certainly reassuring. I hope that I am not, I certainly hope that I'm not being optimistic too quickly, but I certainly see that this looks like we are trending downwards, although we did see certainly an increase in cases here. But certainly this line does, appear to be trending downwards, and I hope I'm not being optimistic. If you're looking at the US, we are rapidly approaching 1.5 million cases. We'll probably be here tomorrow with about, rounding up to about 90,000 deaths. We added about 20,000 cases overnight, which is usual for us, and added about 1,200 deaths overnight as well. And that works out to about 1 death per minute. At the end of this broadcast, we'll have had 60 deaths that have occurred as a result of COVID-19 in the United States. Let me also add, as I do every day, that it's 3 deaths per minute in the globe. It's 1 death per minute in the US. That means that we being the United States, make up 1/3 of all cases of mortality for the entire globe. We're 5% of the entire population. And when you look at the number of cases, we make about 1.4 million. And you can see here that's 4.6 million. We make up about 1/4 of all the cases of the global cases. So again, we're 1/4 of the total global cases. We're 1/3 of the total mortality. And we are only 5% of the globe. Dr. Riggs, I just got something I need to address you. Can you just say a quick word?
Yeah, so we are about 5% of the globe. We are 1/3 of the deaths, 1 death per minute. I want to make the emphasis that I always do, that this is not just numbers, this is people. We are reopening across the country, or attempting to reopen, and nothing has really changed. The virus is still here. I'm going to keep saying it. If you get tired of listening, I'll just say it another way. We have no vaccine. We have no treatment. We have no cure. The only thing we know that works is to stay home. Please stay home. That's the only thing that we can ask. As you'll notice that the purported plateauing has, in spite of the fact that things have slowed down, we still have people dying every day. Our numbers are still going up. We've had across the country 1,200 new deaths. That's 1,200 new community and family and friend circles that have been adversely affected by one thing. I'm not going to steal the rest of his thunder, because he likes his slides. And they're really educational. Doc, take it away. And we got to get rid of that fat doc picture at the front. I will say that.
Yeah, well, we need to definitely do that. I mean, I hate going back to it. And
dude.
I hate having to go to it and reflect on it, man. It's just
I had such nice things to say about you.
I thought you were talking about me. Like,
all the nice things I was going to say, I just throw them out the window. I'm done.
Thank you, Doc. I had a text I had to respond to quickly.
No worries.
So if you look at the number of deaths, again, we're rapidly approaching 90,000. We are going to probably get to 90,000 definitely by Monday's show. And again, I just like to highlight that we are then about 30, is that 90? Yeah, we're about 30,000 deaths away from catching up to the World War I mortality rate that was when I first started putting up the slide, Eric, when I first started putting up this slide, we were well below the Korean War numbers. Did you think that we would ever get like, I mean, in a weird way, this is what I hate, is that I hate that this is possibly even becoming normalized. And that certainly scares me.
So let me just, if you don't mind, I really appreciate, I never understood. I used to always, when you started that, I'm like, why does he keep referring to these wars? Like, I get it, like that's kind of morbid, but to your point, we are in, we're almost, and that's why we need to talk about mental health, because we're almost in a warlike state. We're at war with a virus, and we're having 60 people die in our country in an hour. By the time we finish this, 60 people will have died. That's a warlike state. So this is very comparable to wars. This is exactly comparable to wars, and we don't know how long it's gonna last. I mean, we're just at the beginning, like we've been saying since the very beginning. So I told you I was gonna say nice things. I give credit where credit is due. It's not like this is your first rodeo. It is your first pandemic for all of us, but this is a warlike state.
It's my first rodeo in the US.
What's that?
I said it's my first rodeo in the US.
Yeah, right.
This always happened outside of the US.
But with that acknowledgement, we have to start looking at things in ourselves so we can manage our expectations and manage our anxieties as we deal with each other. It's a depressive state, but it does not have to be a depression. Does that make sense?
Yes, indeed. I think that's a very good point. That's a very good point. If you look at the number of cases, you could see, again, I'm fascinated by why they opted to, send this trend line downward like that. I would have probably, but we're seeing, what looked like, a lull here that looked like there was a peak, and then we're seeing a decline. And as we said, we don't want, this is obviously looking at the US total population. What we don't want to start seeing is an increase, but we know it's coming, especially with this weekend being this weekend. Again, what looks like a trend here for mortality, for US global mortality, seems to be trending downwards. I'm really surprised that they dropped this line even more the way that they did here, despite cases are going up. But we'll see, on Monday, a better idea of what that's going to be looking like. But if you look at this line in total, it does appear that mortality is going down. I don't quite read the line like that. I mean, I know that there are some valleys here with some peaks here. I would have trended the line a little bit more like this. But of course, these are all being computerized and generated with very, very solid, statistics. And again, there's error being around these as well. So they're incorporating the amount of error. But maybe they trended this downward because there was about 4 days or 5 days here of some downward trend. And while we were doing this, I said, don't get used to this, that there is a sense of a quiet behind the storm. And I certainly don't want us to kind of get used to that. Looking at the number of testing, of course, Iceland leads the pack with the total number of tests essentially. Oh, look at that. They added population for the first time. I've never seen that. So with the total number of 164 tests per million people, and you can see that their total tests is about 56,000 out of 340,000. So they're really doing an amazing job doing testing. When you look at the U.S., they added rankings numbers too. Wow, I didn't notice that they did this today in the in Worldometer. And so you can see we ranked 38 in the world for total number of tests, which is about almost 11 million. Which is 260. Which is 11 million per million people. This number to me seems to have gone down. It was up to 30,000 at some point. So this slide is not 100% intact. I will get to that. I think something's not right here. I will get back to that. If you look at the total number of tests, we've tested now about 10,000. Yeah, okay, so 10,000 tests. And is that?
That's 10 million.
Yeah, 10 million tests. You're right. What is total tests here? Something's not right here. This slide.
No, because 10 million would clearly put us at number one.
Well, no, this is per million. This is per million.
Yes, but if you look at the number for
Oh, yeah.
US, it says 10 million
Yeah.
tests per million. So that's obviously wrong.
Yeah, something's not right. This slide is you know, I put this slide together pretty quickly, and I didn't look at the numbers to confirm them. So there's something not right about this slide. So I'm gonna ignore these.
You can't have 10 million tests per million people unless you're testing people 10 times.
Right. So which would be great.
Right.
We want to get to that.
Right.
Here you can see we have a total number of 10 million tests. And 1.4 divided by 10 gives us about 14 or 15%. Again, we want to be under 5% to show that we are testing enough people. When you look at Louisiana, we're about 34,000 cases with about almost 2,500 deaths. We were expecting a huge influx of new cases. As the state reported yesterday, they found something like 800 new cases. So I'm not sure when those are going to go online, but overnight we added about 350 cases with about 31 deaths. Again, Jefferson Parish and Orleans Parish far and away take the lead in terms of mortality and in terms of number of total cases. When we look at the case rates, we are 1, 2, 3, 4, 5, 6, 7, 8. We're still 8th in the country in terms of new cases, and the total number of cases is about 7,000 per million people. When you look at the mortality rate, again, same thing. We are 5th in the country of a mortality rate about 527 per million. And again, I want to bring your attention to the fact that the 4 top states are states that all pretty much are crowded and clustered together. Quite physically on a map. New York, New Jersey, Connecticut, Massachusetts are pretty much located all by one another, but they have very intense city centers, whereas in Louisiana, we have less of those. And of course, we are the first one outside of New England. And of course, what makes us unique is the fact that we have some of the poorest individuals in the country, along with the sickest individuals in the country, and largely due to decades, if not centuries, of institutionalized racism and discrimination, which of course puts communities of color at higher risk of not only getting COVID-19, but of course dying from COVID-19. When you look at testing rates, we are, see, there we go. That's the number we should be looking for.
Right.
Yeah. All right. So the total number of tests in terms of Louisiana has been 253. We have, which works out to about 54,000 tests per million people. Number of, this is our epi curve, and you can see we're starting to see an increase in cases. And I suspect this here is the graph that I was talking about. This is what we're going to see, that increase of 800 of those 800 cases. This here is likely reflecting that the, I'm wondering if that reflects the 500 cases or so. But you can see that this is already reflecting the cases that's going to probably show up on Worldometer tomorrow. This is the number of deaths in Louisiana, and this definitely does appear to be trending downward. And so that's good news. I hope it stays that way. I suspect that with us opening up again, I'm not 100% sure. You could see Brazil had its, again, #1 day of new cases. So they are continually having new record number of cases. Right now, Brazil is number 6 in the world of cases. Everybody's watching Brazil, as I am, just because there has been just a really gross lack of attention that has been paid to the people of Brazil. And what we've said it once, we said it again, it's the favelas in Brazil, the so-called quote unquote, this is a word I'm not fond of, but the quote unquote slums, the favelas of Brazil, and the people who are maintaining intact social distancing are coming from the so-called gangs of the favelas, to making sure that they stay safe, because unlike the US, or like the US, there has been a lack of centralized coordination And again, we're seeing what looks like possibly the second highest day of mortality that has been happening. I guarantee you this high case of cases here is going to, in 2 weeks, reflect high rates of mortality. My heart goes out to those in Brazil, especially those that live in the favelas, those that are the most vulnerable people in Brazil. This is our dashboard. Again, this is looking at Orleans Parish. When we look at the daily number of new cases, New Orleans Parish seems to be very stable. Here we're seeing a jump in new cases here in Louisiana. When we look at mortality, our mortality has more or less stabilized. I mean, this is a lot more than we want to be. And you can see there's been a little uptick here in Orleans Parish. And then looking at new tests, there seems to have been a huge rise in testing, and that's somewhat fallen off a little bit. Hopefully we can get more of that testing to be done. And then lastly, we have plenty of ventilators that are available. So for all those that are going to be going out to enjoy yourselves this weekend, feel very comfortable knowing that there's ventilators that are available for you, and there's plenty of ICU beds for you as well. You know, if you feel like going out this weekend, know that we've got your back. So with that being said, these are some of the milestones to progress. But before we get to those, I'm going to turn it over to Doc Griggs for any commentary. We do have our guests starting to be queued up here. So that's, I just wanted to give you a heads up on that too.
So I want to talk about something that you bring up every day, and social distancing, clusters, blah, blah, blah. You make it a point when you go over the slides every day to talk about how the top states in the country are in the Northeast, and that Louisiana is at the top of not just the South, but everywhere else. I want you to talk about the significance of that, so we can give people full context
of why Louisiana remains in some of the top measures.
Well, no, just the significance. Well, yes, but the significance of those states all being in the same cluster. It's obvious to us what we talk about, but I really want you to spell it out.
Right. I mean, I did mention it a moment ago, but just to kind of, again, go over it again, because I think it does bear repeating. When we look at the mortality of these states right here, again, one thing that you will note is geographically, they are all located in the same position of the country, or the same location of the country, rather. New York, New Jersey, Connecticut, and Massachusetts are pretty much all touch one another. Those are also some of the first states that were colonized, if you will, and so they have very densely populated city centers. And so, of course, this is a large part of where the epidemic was here, as you can tell by this, and then also here. But again, these 4 states are also tend to be more affluent states. They tend to be states with more public health infrastructure. They tend to have more responsive. They expanded Medicaid fastest and tend to have a more robust response to populations than we have seen states in the South. When you look at the first southern state on this list, again, we're looking at mortality, mortality rates. You can see this is Louisiana. And as I mentioned, and as I hope maybe Doc Griggs will give us some of his insight into this, we see that Louisiana, again, has the highest rates of mortality in the South. And that's largely due to the fact of, again, poorer state, folks that have higher allostatic loads. In other words, they already have higher burdens of chronic illnesses. These are illnesses due to diseases of poverty, such as diabetes, such as cardiovascular disease, such as hypertension, and also, more important than anything, poverty and institutionalized discrimination are pre-existing conditions. The reason why diabetes, the reason why there is heart disease, the reason why there's hypertension, the reason that there is a lack of access to healthcare, and there has been traditionally a lack of access to our privatized healthcare, has largely been due to institutionalized discrimination upon communities of color. And I think that institutionalized discrimination that has been, that the communities of colors have been subjected to in Louisiana, and also those that are at the bottom of the socioeconomic scale, but communities of color mostly, that itself is a pre-existing condition. It should be considered its own health risk factor as well. And I would love to get your thoughts about that, Dr. Riggs.
So I was trying to sneak and look it up without the epi stats, but the answer is absolutely yes. So let's lay that platform and groundwork, and we'll start down at the bottom. Louisiana tends to lead the nation in being at the bottom of health disparities. I work with the American Heart Association, American Cancer Society, American Diabetes Association. When it comes to social determinants of health, we are at least in the bottom quartile, if not at the bottom. And that's something that we're not proud of, but we've been working on and been improving on for over the last decade. With that said, to end on, to speak on a higher note before we get to our guest, Dr. Derry, one of the reasons, if I've said it all along, if you count more fingers, you're going to have higher numbers. Louisiana, we are also in the top when it comes to number of tests per capita. We've been doing, I can speak specifically for New Orleans and for the state of Louisiana, we have been doing, and when it comes to tests per capita, tests per million, as you can see, when you look at the case numbers, we're doing an excellent job and still improving on actually doing the tests. So our numbers are going to be higher, A, because of the social determinants of health, but B, because we're doing a yeoman's job of trying to test as many people we can with the available resources, supplies, and man and woman power that we have available. So the answer is absolutely, but we're working on it.
Can you comment a little bit about some of the work that you are doing on it? Is that something that you're able, if not maybe directly, which I would of course love, but if you can't directly, maybe kind of hint around or maybe give us some kind of general brush strokes of some of that work? I know that you're doing some
general brush strokes in, well, yeah, in conjunction with some of the schools around here, we're working on the aspect of contact tracing. As you know, it's not as simple as something that you can watch a video, take a test, and go out and do. It is community medicine at its essence. And when there's no COVID-19, that's community medicine. So we're working on assisting and training the staff, training the students to potentially supplement whatever labor might be available. And of course, as you know, I'm working to help educate the public, the general public, in terms they understand about everything that's going on around us.
But in particular, I was talking about social determinants of health.
Well, the social determinants of health are exactly that. In deciphering that term, it's community. There's things on the ground to make sure that things like food deserts don't exist. Actively getting involved with people that do the work, the food delivery programs to areas that don't have access to healthy food. The job programs, the health education, the screenings. When we work with Access Health, that's an integral part is patient education. You have to give things to people so they can give it back, so they can get involved in the policy portion. Community medicine is 3 Ps, people, practice, and policy. Just like you been predicting a pandemic because it's time for another infection. If you think of the other side of the microphone stand, have been predicting that the healthcare system is going to fail because we're not properly communicating the message to the people that need it. We're telling them what they need, not listening to what they want or what they're hearing. So here we are at the forefront of it with you in the schools, on the ground, dealing with something we've never seen before and giving very real commentary on what's going on so people can manage their hopes and expectations.
That's great. Well, thank you so much. With that, let's take the opportunity to welcome our guest. In fact, I think she's going to come on for one quick second. She's trying to get her video on. Ms. Charmaine, are you able to get your video on?
Yes.
Great. We would definitely love to get that video on. I think Miss Sydney is going to contact you to help you if you need help turning it on.
Okay, I'm seeing you now.
Okay, I think what's going to happen is I think Miss Sydney is going to call you. I'm going to just put you on mute right now and let Miss Sydney help you get online, so that this way we can have a conversation. It's a little easier if we can actually see you. She'll help you with respect to getting you back, getting your video on. So with that, Doc Griggs, there's a couple things left for, oh, there we go. All right.
Okay.
Can you bring your computer down or so we can see a little bit more? Yay, all right. All right, there you go. It's such a pleasure, Ms. Charmaine, such a pleasure. My name is Dr. Derry. That's Doc Griggs. This is our daily COVID-19 show called NoiseFilter. And we also do have a podcast. It's a 10-minute podcast. So folks want to subscribe to that podcast, they could do so on any of the regular subscription platforms. Please leave us a review. So this way it gets to more people, as well as a rating as well. So, and also with that being said, I think this show may be airing on WHIV at 11 on Monday, by the way. Dr. Griggs,
Okay.
that we're going to be airing these on WHIV. So with that being said, Ms. Charmaine, thank you so much for appearing with us. Did you want to just quickly introduce yourself to our audience?
Okay, I'm Charmaine Rousseff. I worked for 41 years and retired last year. I live in Luling, Louisiana, and am heavily involved in my church.
That's great. Good. Well, that definitely gives us some things to talk about after we're done. Were you involved in schools? You said you were retired. Were you in education?
Not in the school system, no. I worked in industry.
In industry, got it. Okay.
Chemical.
Got it. Okay, great. So now you had a story that you wanted to share with us?
Yes. So on Palm Sunday, April 5th, I started with some symptoms, and I thought it was maybe from some oysters that I had eaten. So I started that evening with nausea and diarrhea, just constantly. That went on through Monday. And then Monday evening, I started having fever. So by Tuesday, I called Dr. J. It's Jay Ashkrishnan, who works for Access Health. And we did a telemed visit.
Mm-hmm.
So when I described these symptoms and back up, I also had a severe headache that would not go away.
Mm.
So when I described the symptoms to Dr. J, he had me get tested for coronavirus. This was on Tuesday, and I was basically lethargic, just lifeless. Even to shower, it took the breath out of me.
So
But
were you short of breath as well?
actually, I was very winded, but I never experienced the lung problems that other people have. I am a type 2 diabetic with high blood pressure, which put me at a higher risk, as that being some of the underlying conditions. And so Dr. J had me go and get tested. And when I did, 2 days later, I did get the test results back saying that it was positive, which I already knew from the symptoms. And just as weak, I just felt like I could sleep onto the other side of the world. So he actually prescribed a Z-Pack for me and some cough medicine. And I'll have to say, I think that Z-Pack helped me get through it, and Tylenol. And so the fever lasted no more than 3 days. And so
how high was your fever?
the highest my fever got was 102.3. And I'd like to make a point. I know there's a lot of focus on taking people's temperature and not letting them get in certain places if they have a temperature. Coronavirus does not necessarily give you fever. Okay, so myself, I had the fever for 3 days, but had I been tested anywhere before or after those 3 days, I didn't have a temperature. It was perhaps 99 point something and never got past 100. So I think that's very important for everyone to realize.
You know, that's actually a very good point, because we now recognize initially when we started seeing COVID come out of China, there was something like 98% of people, and this is an interesting point, who were hospitalized had fever, 98%. But those are people who are hospitalized, sick enough to actually go to the hospital. But what we didn't see initially were the mild cases. And
Right.
I know you probably wouldn't consider your case to be mild, but the way that the CDC defines the case, it is technically a mild.
Right. I'm very blessed.
Right. And so, especially with the diabetes being on board
Exactly.
and stuff, absolutely.
Yes.
So, but your point is otherwise well taken. Real quick, Griggs. The other point that's really important is that that it added to the delay, the fact that we had so little tests, that we were only testing those that were the most likely to be sick, which were people that had fevers, and because of that, it allowed for more virus to spread through the community, because we weren't able to capture all of those people who didn't have fevers and who weren't asymptomatic. But your point is otherwise well taken. I think we have done a better job with making sure that there's more people who are getting tests now that aren't symptomatic. Dr. Griggs, I'm sorry.
Yeah, so what I was trying to say was that you're bringing up a great point, even moving forward. A lot of the things that we're doing as it relates to reopening is they're talking about taking temperature checks. What you've watched is there's a term in virology, there's a term in public health, there's a term in science called genetic drift. We've watched the virus evolve. We watched the symptomatology evolve. According to the studies that we have been doing, they're starting to notice, and even anecdotally, we're noticing on the front line people reporting less and less fevers as their initial symptom. So if we, on the back end, start trying to reopen, and we're doing this thermography to screen everyone, we can't grow overly confident in that being the screening exam. Just like we had to expand out the number of symptoms, like you were discussing, there are a lot of people that were missed. If we just went by dry cough, fever, and shortness of breath. So our screenings have to evolve, and we have to become more expansive, because viruses don't read books, right?
Right.
I wish they did.
Right.
They'd be a lot smarter. So your experience, I hate to drag you through some of these probably unpleasant memories. So first, let me ask you: do you know what your risk of infection was? Were you somewhere beforehand, or when did you start to do stay-at-home measures?
Actually, I quarantined myself. The last time I had been out of the house was March 16th, when quarantining was just coming about. And I remember going to the grocery store, stocking up because of the unknown, right? But I had some contractors doing work at the house, and they were in and out. And I also have a daughter who lives with me. She works for Access Health, still seeing patients. So I have no clue where I got it from.
Wow. And so you had not left the house, huh?
Right. I did not leave the house, and we were, any deliveries, we would put the packages on the side. We'd probably kick them in the house so we wouldn't touch them, and we wore the gloves and the mask. I was overly cautious, and it just took me by surprise.
Sure. It just goes to show what Doc Griggs and I have been saying this whole time, over and over again, respiratory route. It's very, very little with respect to, as you are implying, your hand hygiene was excellent. You've done everything that you could to decrease the likelihood. This is why masks are important beyond anything else, because it's respiratory route that increases the likelihood of transmission. Now, you said that you had a telemedicine call. Can you tell us about that?
So that was with Dr. J, and he, basically I described the symptoms to him, and he said, let's get you tested just in case. It sounds like you could possibly have coronavirus.
Right. And it was headache, it was nausea, and then it was some GI distress, wasn't it? Not the common things that you typically hear about. What was it like seeing a doctor on the computer screen instead of in the office?
Actually, we didn't see each other on the screen. It was basically a phone call.
Right. Yeah. Okay. Was that the first time you did something like that?
Yes, in the medical field, definitely.
What was that like?
Actually, it was reassuring, like not to be exposed to more germs, have not to go in the office. And I really felt good about that. I know Dr. J, he's been in the area forever, and he's awesome. He really knows. He and Dr. Raj both, they're awesome.
Yeah. They certainly are. They certainly are. Well, and now you're feeling better, huh?
I am. It's 5 weeks later from when the symptoms began. And the only symptom I have, I guess a couple. One is I don't have all of my strength back. I can get easily tired, and I find myself napping during the day. And the other one is my taste is still not back 100%.
Wow.
I did a homemade soup yesterday, and it wasn't tasteful at all.
Didn't taste it.
So I'm still fighting those two.
How long ago were you diagnosed as positive?
I was diagnosed on April 7th. The symptoms really started like April 5th, Palm Sunday. And so it's about 5 weeks later.
So you're bringing up an excellent point that a lot of people don't realize, that you can be positive or anywhere from 3 to 6 weeks. And you're bringing up two actual points, is that people think about being actively infected. And I know one symptom that I've heard a lot that you might be able to identify with is that one day doesn't feel like the next. One day you'll feel up and then you'll feel down.
That is absolutely correct.
Yeah, so it's the equivalent of driving a car, slamming on the brakes, slamming on the gas, slamming on the brakes. And after a while, once you get off that bumpy road, it's going to take a while for the car to stabilize. So as you're in your car, you're going to still feel tired because, man, that was a rough road. So you have to think about this as a journey, and we're just glad that you're along the way. But Dr. Derry, just symptomatology wise and pneumonia wise, from any virus, how is this? It's normal to feel fatigued, and how beat up are you after going through a pneumonia and a viremia?
Sure. So what the fatigue is coming from the stimulation of the immune system. So when the immune system gets stimulated like that, you hear and see about fatigue. The most fatigue I've ever seen with an illness were people who had Ebola virus disease. That was fatigue beyond anything I've ever seen before. This is because largely of a massive stimulation of the immune system. And remember, immunity and inflammation are the same thing. They're two sides of the same coin. And the example I usually give is you have children, Ms. Charmaine. If you could go back to the days when you used to have to take them in to get vaccinated, when you would vaccinate them, would they be cranky the next day?
Sure. You had to give them Tylenol, and they were.
So that's their immune system being activated. And that crankiness was just from the inflammation and the fatigue and all that stuff. What we're seeing with COVID is, and you're describing it really nicely, in that it's, and thank you for sharing your experiences with everybody here on the video and then on the radio on Monday, which is essentially is just really long-standing fatigue as a result of that prolonged inflammatory response. I can assure you it's going to get better over time. Your immune system just got kind of pushed over into overdrive, and it's just very, very, like Dr. Griggs was saying, using the car analogy, it's just going to take a while just for it to kind of slowly come to slow down on its own without having to pump the.
So, Mr. Charmaine, I'm just really glad that we got him to admit maybe he has a viremia or something, because that dude can be really cranky sometimes, just cranky. Cranky. That's exactly. I'm gonna be like, he's got a viremia. He's cranky.
No, dude. The crankiness is having to work with you. To be clear, okay?
I just want to share one more thing. I did retest about a week ago, and I am negative.
Right. So that's great. So that means you cleared your virus. But when you retest, they tested your nasal.
Yes, I went to the Hornville High testing area.
Did you do it? So you did a self-test then?
I did a self-test, right?
Did you do it just to see?
Well, I called Dr. J's office, and I wanted to know, was it safe? Not that I wanted to go around my mother, but she's 91, and I usually do her grocery shopping and all that. So I just wanted to know, even wearing the mask, was I safe enough to do that much for her. And he
Right.
suggested that I get retested.
Yeah, I would say wearing a mask is single-handedly the most important thing that you could do, and that's something that we talk about on this show.
Right.
3 to 5 to 8 times an hour. The thing that I'm most interested in too is if you can talk to us about your experiences with and moving forward with the church and how things are going to be, how things were for the last couple months and then how things are going to be moving forward.
Okay, so we have had, prior to that, I was involved with the healing ministry and a money counter every third Monday. And so I'm trying to think what else. I'm having a Corona brain moment, but anyway, more involved than that. And so we went down to having Mass online. Our priest at St. Anthony of Padua in Luling, he did live Mass on Sundays at 8. Now this coming Sunday, since everything is basically, the restrictions are being lifted some, we're scheduled to have Mass outside at 9:15. I'm not sure if I'm going. I'm really not sure. I'm praying on that because I don't want to, first of all, am I immune from getting it again? I'm not sure.
Yeah, we don't know. We haven't seen examples of reinfection. So it's hard to make that assessment at this point, but I think it's fair to say that we don't know. If you were to force me to answer, I would probably lean on the side of it's probably not, but I don't know.
Yeah, if you were forced me to answer, I would say, I don't know. We're not sure about the testing. We're not sure about the virus behavior. We're not sure about a lot right now. For a virus to have only been around for not even 6-7 months to try to predict what it's going to do a few months or a year from now is not, it's just going to take time. So, but I will say this, at the root of everything that you hear Dr. Derry and I say, we're going to tell you to err on the sides of stay home.
Right. And that's really what I'm contemplating.
Right.
To stay home.
So your church closed down right away.
Yes.
And this will be the first live Mass, and then they're doing it outside in like the parking lot, or
in the parking lot.
And are they trying to get a sense of how many people are going to show up so they know how many chairs to keep people?
Actually, you bring your own chairs. We were instructed to bring your own lawn chair.
And are they mandating everybody to wear masks as well?
It's not mandated. I haven't seen that in the note, but I mean, if I do go, I will definitely wear a mask.
Yeah. Ooh. And then I'm not much of, I don't know a whole lot about religion, so you'll forgive me, but I know that I think with Catholic masses, there's some part of it at the end when they drink from a common cup and they eat like a wafer. I'm sorry, I'm an atheist, so I don't know.
Okay, so
it's the body.
Right.
So the wafer is Holy Communion, the body of Christ.
Sorry, communion, of course, I knew.
Now you need to get with it.
No, can you say that? He's so cranky. I'm so glad you said that. Oh, Mr. Arman, can we have you on every day?
I've been an atheist since I was 14 years old, so you'll forgive me. Right, the communion, and then the drinking of the wine from the cup.
Okay,
right?
So that is completely cut out because yes, we used to drink the blood of Christ from the same chalice.
Right.
So that's completely cut out. That's not going to be offered.
Do you think that is forever going to be done? I mean,
I can't say forever, but for now. And for me, it may be forever. Too risky.
And then what about communion? Are they going to still offer communion, or how
yes.
is that? Okay.
Yes. Actually, you need to Google Father Anthony Odion from St. Anthony of Padua in Luling. He has the gift of healing. And so once a month, on the last Thursday of every month, he has a healing mass that starts at 6 p.m. God has given him this gift of healing with lots and lots of miracles that have taken place. So that's the thing that, I mean, amongst everything else in receiving the body of Christ, I truly missed that. We haven't had it. We weren't able to have the March healing or April, and I doubt if we'll have May, I'm not sure.
Right. You don't think they'll be doing them outside, or is it going to just be too hot to be outside at that point?
That's a bit different. And
Oh.
it's usually like in the evening.
Got it.
So I'll probably scare you when I tell you that the majority of the people who stay for the healing part after Mass, they rest in the spirit. And that may scare you, but it's real.
Okay. Absolutely. Absolutely. Well, I want to thank you so much. Was there anything else, Mr. Armain, you wanted to say, or?
No, I had written some notes. I just want to make sure.
She put her eyes on, so she ready. Let her say, yeah, she put her eyes on. We ready. We sit up straight, Mr. Armain. I'm ready.
You're ready? The only
I'm
other
ready.
thing that I experienced in the midst of it all, especially at the beginning, my glucose level was higher than normal. I'm a bad diabetic because I'd never listen and do what I'm supposed to, right? But I'm on Lantus, an insulin twice a day and metformin twice a day. But I was not eating anything at that point. And I had, you didn't want to eat. You had the nausea and the headache. You just didn't want to eat. However, my sugar level stayed high. And I'm more than sure it's because of the infection.
Yes. Well, it is because of your body's response to stress, your body, the inflammatory response. Your body's going to do everything it can to try to respond. Part of the stress response, you have just a normal stress response. You have cortisol, you have epinephrine, your blood sugar goes up, blood pressure goes up. Then you want to factor in your immune system kicking in. There's a number of, there's a number of all you know is your sugar was up. You weren't eating. What's happening? But here we are. And now, out of all things, you're going to take your medicine the way you are supposed to. Yes?
Oh, yes.
And let me ask you this. Were you a regular influenza vaccinator as well, or did you skip on those?
I never skipped.
You never skipped. Okay. It's my prediction that we're going to run out of influenza vaccines by Thanksgiving this year. We usually run out in February. So
yes.
So before we get close to the end, I want to know what you would tell someone that's saying that that's taking this virus lightly. All these people are going out, they're planning happy hours, they're planning parties. I want to know, Doc and I'll be quiet. I'll even go on mute. I want you to tell people what you think and what to do about this virus.
Okay, so this virus is real. And I truly believe the people who don't take it seriously, they have not had a family member or someone close to them with the virus. This past Monday, I lost a cousin. He had been in the hospital on a respirator, he and his wife. He was brain dead, okay? So he died Monday night, she died Tuesday morning. This is real. Don't take it lightly. And you need to respect other people. I think that we live in very selfish times. It should not be a time about me. What's in it for me? I'm stuck inside. I'm not having fun. Well, it's time for us to stop. I truly think that God is telling us, repent of your sins. The first thing you see open is the casinos. It shouldn't be about all fun. Yes, we can have fun, but it's time to take life seriously. This is real. And if you do what you're supposed to, you wear those masks, you wash your hands, you stay the distance, right? Then you can help everyone. And don't just think about yourself. Exactly. So that would be my word. Think about others before you think about yourself. Quit being selfish. This is funny.
Mr. Armain, we do have a couple minutes left that Doc Griggs and I need to get to, so I just wanted to say thank you so much for appearing on our daily
pleasure
show. Thank you so much. We really wish the best for your health, and please continue to remain in touch with us.
You have a wonderful infectious spirit, and we're so glad that you're here. Thank you.
Thank you so much. It was my pleasure.
Thank you so much. All right.
All right. Bye-bye.
All right. Bye-bye.
Bye-bye.
What a great story. Thank you again to Ms. Charmaine. It was amazing. I did want to get to a couple stories because there's some funny ones on here. Dr. Griggs, I wanted your opinions on. Let's go. All right. Oh, look at that. Here, Doc Griggs, look at this first one. Fears grow over new outbreaks as more states lift restrictions on bars, beauty shops, and other businesses. Any thoughts about that, Doc Griggs?
Who knew? Who knew? And water is wet news.
Yeah, right. Wow. All right. Well, you know what? I'm fearful of it as well. So it's nice to see that we are being represented there. The latest retail sales report depicts the largest 2-month decline on record. Of course, that was to be expected. All right. Who's enforcing mask wearing rules? Often it's retail workers. Again, we are asking these people who are on the front lines, these so-called essential workers, to really go beyond the call of duty. And it should not be retail workers. It should be like, we had an amazing guest on yesterday, council member Danny Babin from Terrebonne Parish, who led by example. He walks around. Did you say Homa was in Terrebonne Parish?
Homa is in Terrebonne Parish. He represents 3 of the 5 bayous, I think it was.
3 of the 5 bayous in Terrebonne Parish. And he walks around handing out masks. Yes, I love it. Yeah. Right? And so we need to not have our retail workers. When you go into a store and you don't wear a mask, you risk transmitting your virus to somebody else. And clearly, I find it to be somewhat selfish. Yeah. So the new vaccine SAR says that finding one by January is credible, but difficult goal. All I've got to say about that is, yeah, right. I do not believe that in the slightest bit. Or maybe if maybe they're saying finding one is maybe they found a target, but it's still going to take another 1.5 years to develop it, test it, and scale it.
Doc, I gotta give you another angle. He's saying nothing different than Dr. Fauci and what we've been saying the whole time, that it's credible that within 12 to 18 months we could happen, but it's not likely. It's difficult. He's okay. Yeah, I'm glad you're on board. That's exactly, you just use different words, and yeah, okay. Yeah, manage your expectations.
Eric, just to push back a little bit, I just don't want to give people false hope and false
That's why I said manage your expectations. Right. Manage your It's the way that it's said. By us saying that we should manage our expectations, 12 to 18 months is a very short period of time. Normally that takes 10 to 25 to sometimes never. 12 to 18 months, everyone's looking maybe, as opposed to stepping up saying that we will do this, but it will be hard. It's all in the delivery, right?
Right, absolutely. Listen, real quickly, House of Representatives is supposed to allow members to vote remotely for the first time. I think that's great news. I think that this is one of the silver linings of COVID, is that society is starting to change a bit. And if we could start with the House of Representatives, I think
I have a quick one for you. I have a very quick one for you, and it's very recent. They had the White House update today. There's that new test from Abbott that all of a sudden there's pushback saying that it's not accurate enough. It's an antigen test. Doc, can you talk a little bit about that, please?
We have 2 minutes. Essentially, antigens are pieces of the virus rather than the PCR test that looks at the DNA, the RNA of the virus that gets converted to DNA. And so it's a lot more rapid because you don't have to go through the process of converting the RNA to DNA and then having to amplify that DNA in what's referred to as a polymerase chain reaction, or a PCR.
Is it accurate?
I don't know yet. I'm assuming with this first Abbott test, there's a 30%, there's a 70% sensitivity on it. In other words, there's high false negative rates on it. This is what the White House has been using. And if there is an outbreak that's happening in the White House, that's largely due to the fact that 3 out of 10 people are being tested as negative. They're probably allowed to go in and work, and yet they're probably shedding virus. We have another minute. Is it safe to go out to eat, Doc Griggs?
Stay home. Stay home. Stay home.
Stay home, y'all. Is it safe to eat? How do I answer that question? I say absolutely not. I would not recommending going out to eat at all. I know people are really wanting to do so. I just want to remind everybody that we have seen increases in cases largely due to the fact that people don't stay home, that restaurants and certainly areas of the restaurant where people are not masked because they're eating, and there's air conditioning, that people are getting viral transmission. So with that, we have to go. Thank you very much. Please subscribe to our podcast, which is NoiseFilter. It's on 10 minutes, high yield, bite-sized information, 5 days a week, Monday through Friday. Doc Griggs, any last words?
Stay home. Wash your hands. Wear your mask.
Wear your mask,
Protect
wear
your
your
finger
mask,
movement.
wear your mask.
Stay home.
And remember, health is a human right.
Stay home.
Peace out.